Hey everybody, I'm Allie. I'm a geriatric occupational therapist. I work in mobile outpatient in my own practice as well as part-time in the hospital acute care. So this video is going to explain everything I know about shoulder injuries or surgery and how to position, how to care for, and what to look for daily occupation situations. That was a mouthful. Let's get into it. First, the sling. Every time I go into a patient's room and they have tried to adjust their sling, it's like this. Every time you walk in, the patient's sleeping, they're back on the bed. I got this way over here. It's all crumpled up. It doesn't fit, right? So what do? First thing, I teach them how to put it on. If you got a shoulder surgery, you're not doing this, obviously. Big thing, this is a little too small for me, so disregard. I would want this length to come fully over at least the hand. If it's past the hand, great. If it's not, everybody's got different size arms. So this one I've had since I was in middle school. It was in my closet, so we're rolling with it. You're gonna want this to be, you don't have to use that to like loop through, but I guess you could if you wanted to. The big thing is it's gonna be supportive of the wrist. If you see any of this going on, not helpful. That's gonna push on the nerves. That's gonna cause just super uncomfortable for this part of your arm when you've already got a lot of pain going on up here. We don't want that. What you want, full arm coverage. This one's not long enough for me, I said that already. Make sure the wrist is supported. There's no wrist dropping here. You want it to be straight. The other thing is if your patient is hiking their shoulder like this, which 9 times out of 10 they are, it's either too loose or too tight. You want to find the perfect medium for that patient. What I always educate patients on how to do it themselves is if you're hiking like this, you're gonna hurt. It's gonna hurt worse because you're guarding. If you're reaching into the sling like this, it's gonna hurt because you're pulling on that socket. And if you just had surgery, you don't want to be doing that. Biggest thing you want to be doing, neutral. Neutral here, forward and backwards, neutral up and down. If you can trust the sling, see I can't, it's not tight enough yet. I'm reaching for it. My elbow is not quite there. If I really had to do it, I'd be pulling. So what you want to do, elbow back in that pocket. And I'm gonna show you here so you can see it. Obviously, if your patient has surgery, don't rotate their arm. Take it off, tighten it, or you tighten it for them until it's in the right place. I'm gonna bring this up maybe another couple inches. Position it here. See now what happened? Too tight. I'm shrugging. I'm holding it up here. What I want to be able to do is go and relax. The best thing you can tell that patient to do is trust their sling. Relax into the sling. Trust the sling. Is it comfortable? No. Is it gonna hurt? Probably. But what they really need to do is trust this sling, because if they're not, they're either guarding or reaching. That's gonna cause more pain in that shoulder in the long run. People that are always complaining, well, it hurts so bad, I can't do anything with it, I can't even get out of bed. That's because you're guarding it constantly. You're holding it like this. You're not giving it a chance to relax. Those muscles have been through a lot. Breathe. The amount of times I tell my patients, you're guarding your shoulders, breathe. Drop it down, trust the sling. The more they can trust this, the more they can actually rely on it to do its job. Then they're not having to shrug and move that shoulder around where they shouldn't be doing that anyway. The next thing is positioning. I mentioned forward and backward. And 9 times out of 10, again, when I go in, what do they have their shoulder in? Internal rotation. They've got it like this. They've got pillows underneath it. They're trying to support it. It hurts. Yeah, guess what that's not going to do? Let it stop hurting, because you're turning it in a place you shouldn't. If you have, I'm going to show you from this side. If you have your shoulder internally rotated really dramatically this way, or externally rotated when you lay backwards, what's it going to do? Hurt. So what are we going to do? I'm going to bring you, come this way. I'm going to show you. When we're laying down in bed and we're going to try to fix this problem, what we're going to do is, I may have to switch arms. Okay. Just for my bed setup here, I'm going to show you with this shoulder. Here. I'm also right-handed, so I kind of, oh, it's dirty. Disregard. It's been in a box for forever, so who knows what it's been touching in there. Okay. It's about the same setup. You get the point, right? So when we're in bed, what happens? We lay back and our shoulder goes backwards. I'm going to be really dramatic about this so you can see. It falls backwards when we lay down. Obviously the bed's not sitting up. You lay flat. If you're laying flat, your shoulder, what does it do? Backwards. So what do you want to do? You want to support the whole arm, rotate it in? No, not even close. You don't want to do that. We're going to make it stay as neutral as possible. And what we're going to do to do that is, instead of putting a pillow completely under the arm. You're gonna put it just under the back of your arm. Let me see if I can show you this on camera. I'm gonna kind of sit in this hole so you get the point. Okay. So instead of putting it completely under the arm, people love to do this. Love to prop it up, love to do this. And then they stick it all up under here. And they're like, it hurts so bad. Yeah, because you're turning. You've got it in. What I want you to do, not under here. I don't want that. I want it resting against you, and I don't want it behind you. So you're gonna put that pillow, or a pillow, wherever your setup is. Let's go back in here. Let me fix the camera, hold on. Okay, we're back. I fixed the camera. So what I want you to do is put a pillow directly behind this part of the arm, here. So see when I sit back, it's not too far forward, it's not too far back, it's just going to, I'm gonna turn so you can see it. It's gonna fall. You rest it here. Arms neutral. If you're in a hospital bed, that's gonna look a little bit different than at home, obviously. You can always put something under here, as long as it's not raising your arm up. You can rest your arm flat on it, and you can rest it behind the shoulder. I don't usually want anything under this elbow where it's making it come up like this, because you're internally rotating your shoulder. We don't want you to do that. We also don't want you just letting it flop down to the side. So keep it supported in your bed, in your environment, the way that it would work best for you. However, what I want you to see is that we're neutral here. It's not externally rotated, it's not internally rotated. We're as flat as we can possibly be here. We're not shoving pillows under it, we're not cramping it up like this. Neutral, flat. And I can still trust my sling. I can breathe down into my sling, I can let it rest in the sling, and it's covering all bases. I hope that helps. The other thing that we talk a lot about education-wise from an occupational therapy standpoint is like hygiene. So if you have shoulder precautions and you're not supposed to move your shoulder, I don't say quotes because you're not, don't move it. What I say quotes about is you can't, oh, I can't, how do I, okay. Use your other arm, right? If you need to clean your armpits, which you should, clean your armpits, please. You can lean yourself forward. You can rest your elbow. You can't see this, hold on. Let gravity do the work for you. Come forward, lean forward, wash up under here. Here, you can't see. There, leaning forward. My back is moving, my hips are moving. Obviously, if you have any other precautions there, don't do that. If you just have if you just have shoulder problems, great, lean forward, let gravity pull you this way. I'm not moving this at all. Look, this has not moved. This, I can reach my arm in, wash it out. Problem solved. I hope this helps. There's a lot with shoulders that I see that get messed up. A big one is positioning, not only of the sling, but of the person in bed. If we're positioning the patient incorrectly, they're gonna have more pain. That's just a fact. As neutral as you can be in that shoulder is gonna help your patient and their pain tremendously. I hope this helps. See you next time.